Hey guys, so what exactly is the difference between addiction, dependency, tolerance, those different features? What is the difference between those? A lot of people ask me that question, and we get a lot of confusion about that. There's a huge difference. Number one, when doctors initially put you on these medications for a legitimate purpose like pain management, a broken foot, or whatever it is, you're just using the medication like Percocet for pain management. If you keep doing that for a week or two or three, you will develop dependency. Okay, dependency is not the same as addiction. That's the most important part to remember. Dependency is just dependency. That's all it is. It just means you're dependent on something. If you quit, there's going to be hell to pay. That's what that means. It doesn't actually mean that you're addicted to it. If you stop Percocet after 3 or 4 weeks, you will actually have withdrawals, symptoms that you will get from that. You'll get chills, shakes, night sweats, stomach ache, diarrhea, heebie-jeebies, all that kind of stuff. That's what dependency is. That's all it means, nothing else. Tolerance, of course, is a little different. Tolerance is the next thing that develops. And tolerance usually means that the amount you're taking doesn't work as well anymore. It used to work. That one Percocet used to work pretty well. But now after a week or 2 or 3, that one Percocet doesn't work. It takes 2 Percocets. And that's called tolerance. So dependency, is that good or bad? Depends on what you're talking about. Insulin-dependent diabetics are insulin-dependent. They are not insulin-addicted. They're not looking for insulin on the streets. They're not using insulin to treat their depression and anxiety. They're simply insulin-dependent, and that is very normal and very okay. People are blood pressure medicine dependent. If they stop quickly, they'll have problems. If the diabetic stops his insulin quickly, there will be problems. That, of course, is where we start using medications like Percocet for the wrong reasons. It's no longer for pain management. Now we're starting to use it for other stuff. People sometimes tell me, yeah, I just use 1 Percocet or 2 here and there, just when there's bad board meetings, because it helps me calm down. And besides, it's a legal drug, right? It came from my toothache prescription, so it's legitimate. It's not like I'm doing anything illegal. And I only take it once a week for board meetings, maybe twice a week. Hardly ever more than 3 times a week. I mean, there was at one time I had to take it, 5 times, but hardly ever more than 6 times a week. Yes, the in-laws were around that one weekend. I didn't have a choice. Everybody understands I had to take it on that weekend, but it's hardly ever more than 9 or 10 times a week. And very gradually, you start slipping down that slope to where you're taking it more and more for the wrong reasons, the wrong doses. You run out of your own prescription. Sometimes you'll ask friends or find somebody that has a leftover, start using their medications. That's where we run into this problem called addiction. That is the definition of addiction. You're using something for the wrong purpose and the wrong dose off of the prescription, and you're using time, money, and effort doing it when you should be doing other things.